Hello, my name is Shamika Robinson, and I am an OTA student. Today, I'm going to discuss thyroid cancer, which is one of over 100 known forms of cancer. This type of cancer, in particular, occurs in the thyroid. Thyroid cancer is a cancer that occurs in the cells of the thyroid, a butterfly-shaped gland located at the base of your neck, just below the Adam's apple. Your thyroid produces hormones that regulate your heart rate, blood pressure, body temperature, and weight. Thyroid cancer measurable learning objective. Thyroid is a common clinical problem. And differentiated thyroid cancer is becoming increasingly prevalent. Since the American Thyroid Association guidelines for management of these disorders were revised in 2009, significant scientific advances have occurred in the field. This picture is an illustration of the thyroid gland and its nodules. In contrast, high-resolution ultrasound can detect thyroid nodules in 19% to 68% of randomly selected individuals, with higher frequencies in women and elderly. The clinical importance of thyroid nodules rests with the need to exclude thyroid cancer, which occurs in 7% to 15% of cases, depending on age, sex, radiation exposure history, family history, and other factors. Different thyroid cancer, which includes papillary and follicular cancer, comprises the vast majority, greater than 90% of all thyroid cancers. This illustration not only shows the location of the thyroid gland, but the parathyroid gland, larynx, or voice box in the trachea, or some would call it the windpipe. In the United States, approximately 63,000 new cases of thyroid cancer were predicted to be diagnosed in 2014, compared with 37,200 in 2009, when the last ATA guidelines were published. The yearly incidence has nearly tripled from 4.9 per 100,000 in 1975 to 14.3 per 100,000 in 2009. The entire change has been attributed to an increase in the incidence of papillary thyroid cancers were diagnosed in 1998 and 1989 were greater than 1 centimeter, compared with 39% of the new thyroid cancer diagnosis in 2008 to 2009. This tumor shifts due to the increasing use of the neck, ultrasonography, or other imaging in early diagnosis and treatment. Trends that are changing the initial treatment and follow-up for many patients with thyroid cancer. Here we have an outward view of an individual with swollen lymph nodes. A recent base study from Olmsted County reported the doubling of thyroid cancer incidence from 2000 to 2012 compared to previous decades as entirely attributable to clinically occult cancers detected incidentally or imaging pathology. By 2019, one study predicts that a PTC will become the third common cancer in women at the cost of 19 to 21 billion in the United States. Optimization of long-care health outcomes and education about potential prognosis for individuals with thyroid neoplasm critically important. In 1996, the American Thyroid published treatment guidelines for patients with thyroid nodules and DTC. Over the last 15 to 20 years, there have been many advances in the diagnosis and therapy of both thyroid nodules and DTC, but clinical controversy exists in many areas. A long history of sufficient peer-reviewed research funding for high-quality clinical trials in the field of thyroid neoplasia may be important contributing factor of existing clinical uncertainties. Methodology limitations of conflicting findings of older studies present significant challenges to modern-day medical decisions making in many aspects of thyroid neoplasia. Although they are not a specific focus of these guidelines, we recognize that feasibly the cost consideration of various diagnostic and therapeutic options also present important clinical challenges in many clinical practice settings. This is a diagnostic overview. Diagnosis is thyroid cancer. Symptoms: a lump nodule that can be felt through the skin of your neck. Changes to your voice, including increasing hoarseness, difficulty swallowing, pain in your neck, swollen lymph nodes in your neck, a cough not due to a common cold. The picture that I show on slide 6 is a good example of swollen lymph nodes. Now I have some multiple choice questions. What is thyroid gland? What is the function? If I need my thyroid gland, how can it be removed safely? And then there's another question. The cancer is only a small part of the thyroid. Why do we need to remove the entire lobe of both lobes? And the third question is, I heard about 2 nerves that are close to the thyroid gland. What are the nerves and why are they important? And to answer those 3 questions, the first answer is thyroid gland is a part of the endocrine system. The system relies on internal checks and balances to keep hormone levels within a healthy range. The thyroid gland produces thyroid hormones. And to answer the second question, even though the cancer itself may only be a small part of the thyroid gland, your doctor may recommend moving half of the gland. And the answer for the third question is the recurrent nerve runs along the backside of the laryngeal nerve runs along the backside of the gland. It controls the vocal cord's ability to open and close, which allows us to breathe and speak. The other nerve runs along the upper edge of the thyroid gland. So now I have some open answer questions. And the first open answer question is, describe the symptoms you are having due to thyroid, and how long have you had thyroid cancer? This was an open question that I had asked my grandmother about her symptoms and when she did first discover that she had thyroid cancer. And her answer to that question was coughing. She had coughing not due to common cold, pain in her neck, and fatigue and dizziness. And the second open answer question was, tell me how your everyday life and what areas of occupations you struggle with. And her answer to the second question was, the areas of occupation she struggles with are ADLs and IADLs and rest and sleep. Her third open answer question was, what do you think about having to have thyroid surgery? And the answer to the third question, she answered, well, I have had my doubts at first, but the more I got educated about thyroid cancer, I think I'm okay with having thyroid surgery. And the fourth open answer question that I asked her was, tell me what goals you want to reach or seek while receiving occupational therapy. And her answer to the fourth question was, she would like to get back to living her regular life and be independent like she used to before she had thyroid cancer. So now what I have here is a discussion prompt. Her limitations of occupations. She is not able to lift objects over 10 pounds because it causes pain in the arms, shoulders, and neck. Carrying objects for a long period causes discomfort with breathing and walking. Another limitation of occupation is she can't push or pull objects that are over 5 pounds due to fatigue, dizziness, and muscle weakness, shortness of breath, pain in the neck and body. Also, lack of stability and balance. Legs tend to give out while walking and has had a couple of falls due to lack of stability and balance. Her disruptive performance patterns and skills are, she mentioned, was cognitive skills, which is memory for her, has trouble problem solving with activities, and has problems with some ADLs and IADLs. She can't keep up with regular routines, follow the sequence of steps involved in meal preparation. Also for disruptive performance pattern skills for ritual, she attends Bible study, which is a spiritual gathering, every Monday and Wednesday, but is not able to attend most nights. Her disruptive performance pattern and skills for her roles were she's expected by society and her church members as a deacon, and choir director is defined as disruptive. She can't perform tasks due to legs start hurting and shortness of breath. So we have more discussion prompts that we went over. Approaches to and types of intervention. were therapeutic use of self, therapeutic use of occupation or activity, and preparatory methods. Therapeutic use of self, which is encouraging them to engage in occupations such as using motivational words, communicating, and helping them achieve their goals. Therapeutic use of occupation or activity is assessments and interventions, such as the assessment that I chose for the therapeutic use of occupation of activity was activity of daily living checklist, and this is for them to regain the ability to assess the areas that they're needing help with, and for them to regain the ability for ADLs and IADLs. For example, bathe alone, meal preparation, and chores. Preparatory methods. Preparing them to engage in occupation performance, sensory, cognitive, and social skills. Okay, so how my objective was assessed, measured, and met. My objective was assessed by measures of the research and information that was gathered about thyroid cancer. I was able to create, analyze, and evaluate my research. The interview I had with my grandmother, I got more information about thyroid cancer from her, so I could grasp the concept of the assessed measurement that I needed to do the presentation, to understand the diagnosis, conditions, and symptoms. So I have a multiple choice question. And the multiple choice question is, which of the following amino acids is the precursor for the synthesis of thyroid hormones? And that would be the tyrosine. Thank you for listening to my presentation